All right, so we're going to work on some TMJ stuff today. So we get a lot of patients that come into the office that either been referred by a dentist or over the course of time have had jaw pain that has developed from clenching the teeth, from improper bite in the back typically, sometimes even in the front, trauma to their jaw in the past, things like that, or just general tension that's caused these problems start to show up. So a lot of people don't realize, but chiropractic can be very beneficial and very useful in solving TMJ issues on there. So I'm using Andrea as a guinea pig here, an example a little bit of this, things we look at, what we see, and how we approach this with people. It's really very simple. It's just we're looking at it from a functional perspective on there. In other words, like I don't care so much what your joint does, what your teeth do, your jawline, things like that. I am more interested in how they all work together on there. So well, typically we'll start with the patient will lay just like this, face up on the table. I'll have them open their mouth fully, all the way down, all the way back up. What I'm tracking for here is the jawline to run straight in line with the nose on there. If they deviate on there, that's a first sign that we got some issue. That's a functional problem. It doesn't drive straight through there. The other thing is this, as you can tell, I'm feeling this at the same time. So when she opens again slowly and then back closed slowly, I'm checking that joint. Is the joint moving at the same time? Is it the same from side to side on there? Is the muscle and balance the same as well too? So real basic things we'll start with is just some muscle trigger point through here. So I'll put some pressure on this. I'll have her work through that movement. So open and close, open, close. We'll work through that a little bit. I'll ask the question, is it worse? You feel more discomfort and tension on one side versus the other? My guess is she probably feels more on the right with that because of where she's tracking. Like she actually does track the wrong way here. So she'll go down about 3/4 of the way down. She deviates to the right side. So make note of that. The other thing we'll work on is actual joint movement itself. If it feels clunky, poppy, restricted, we're gonna open that stuff back up on there. So we're gonna work, again, muscle stuff on here, try to strip that out if that helps the movement on there. Sometimes when we have them open, so we'll have her open all the way. We'll even work in there and dig through that a little bit. And as you can tell with her response, it's not real comfortable. These muscles in your jaw are small, but they're really powerful. So when they get irritated, they get really painful. That's why TMJ problems create a lot of problems for people. So that's the soft tissue piece. If we're going to work on adjusting it, these are the things we're going to do. So I'll either use an activator on here at a very, very low setting so that the force is very minimal, about the same amount of force we do when we put this with small kids, for example. There's not much force going there. It doesn't cause a lot of pain. Easy to do. We don't want to create a lot of force in the jaw. Otherwise, a lot of times we'll create more problems. So simple with that. So we either use the activator, which in this case, I'm actually going to do a little work with her on this, but we'll turn her this way and we'll work through a couple spots here on her jaw. I'll have you open up part way. Yep. Good. Now I'm going to roll your head back the other way on there. Same thing part way. Again, very low force, very easy to handle on there. So that's one piece. The other way we're going to do it, same thing, open for me, close, good. We're going to do just drop stuff. So I'm actually use the table and use the head piece that drops away on here so we're not putting a ton of force into it. Same thing, part way open, a little bit of pressure, good, part way open, good. And then I'm not going to do it with her, but I may go back to the other side there and then do the same types of stuff, just different points of contact on there, working different movements. Recheck it again, close. What we're feeling for is, again, smoother, more balanced movement on there, as well as typically as a patient, you may feel the movement's different, but the symptom's not going to change right away because there's inflammation in there to begin with. So that inflammation needs to fade a little bit over the course of time for the actual problem to be quote unquote resolved on there. But again, anybody who has abnormal bite right now, anybody who clenches their teeth at night, anybody's had trauma to their jaw, dental work done, significant dental work done, these things need to be done proactively so you don't end up with bigger problems down the road. The other thing that has a lot to do with your jaw is your upper cervical spine. So their upper neck on here needs to function properly. That's the neurology that feeds this TMJ in here as well too. So all these things work together. We've had people come in, they feel like they have an ear infection, they've got to do antibiotics, they've done tubes, they've done this, that, the other thing, and it's their jaw. Their jaw can create pain because of the eustachian tube that refers back up into the ear itself, and it feels like it's an inner ear type of infection on there. So again, proper diagnostics with this help to actually get to a proper form of treatment, which gets you to a better outcome on there. So again, if you suffer with this, somebody else does, if you're a dentist out there as well too, look at chiropractic as a possible solution. This is not the end all be all by any means on it, but we see a lot of jaw things get better in here because it's a really simple, functional approach to how these things work.